Hello again, this is Dr. Rutledge, and I have a finish on the other story that I told earlier today. The patient who called and asked about her anemia or her passing out, and we talked together and came up with the diagnosis that she might have anemia. She had had it when she was younger, and so since she had passed out, I recommended that she go to the emergency department right away. She was a little fussy, but gave me permission to tell you her story, which is in the ER. They found that her hemoglobin was about 1/3 of normal. So it was low. And the doctor was going to send her home. He said he wasn't going to do a blood transfusion. And so I mentioned to her to ask him if he could give her an iron infusion. And she got the iron infusion, and she sent me a little note saying thanks and that I could share it with all of you. So that's the story on iron this morning. The interesting thing, though, is I talked about the most common problem for iron deficiency anemia in MGB patients, which is that patients get a low iron because they are female and have a loss of iron regularly in the normal day-to-day of their life, having a menstrual cycle. Now, it turns out that's probably 90+% of my patients. I would say the majority of my patients who have iron deficiency anemia have it because they're female and they have a menstrual cycle, which is where they lose blood in their monthly cycle. So that takes care of most people. But then there are another small group of people and some confused surgeons who might be interested in the second part of this talk. If you have had a low iron and you are not female, you're a man, or if you've tried iron and you keep having trouble with it, I would like to explain another mechanism that we see that's often misdiagnosed and mistreated by physicians, especially those who are not familiar with bariatric surgery or the MGB. So first of all, many patients tell me I'm taking my iron pills and I still have to get iron, and I'm not having a heavy period. And so they say, what's wrong? And it could be just their MGB, but I also see this in sleeve patients and other patients who contact me who don't even have bariatric surgery. So I want to explain the link between your diet, inflammation, and low iron. Now, if an average doctor hears this, they're going to say, oh, I know what he's going to talk about now. He's going to talk about eating high iron foods like meat, beef, and things like that. But I'm not, because many of my patients have already been advised to eat a high meat, high protein diet, and they still, in this small subgroup, can have troubles with a relatively low iron and be getting iron infusions repeatedly. And they call me because they're frustrated because they continue to have this problem. So I'm going to talk about that now. And I'm going to explain quite simply that you may have iron deficiency, not because you have low iron, but because you have inflammation. Okay, what? Well, let me explain. When your body is attacked by an invading bacteria, the bacteria, in many cases, depending on the kind and species of bacteria, needs iron to live and multiply. And in fact, people who have higher iron are more susceptible to infection. And we'll look at a couple of slides about that in a minute. But the reason I bring it up is because what we see in patients who are resistant to getting healthy and getting a normal iron, even though they're taking some iron, it's often because they are created an inflammatory situation in their body. They are sick because of what they're eating. Now, we're going to say this again. The normal mechanism of the body to protect itself when it's sick and it fears invasion is it hides the iron. It takes the iron out of the bloodstream, and you can even get an anemia of chronic disease. The body and its stores of iron are actually overall high, but you don't have enough blood because your body is sequestering, hiding away the iron to protect against what it perceives as an infection. But it's not exactly an infection. It's the body's response to being sick. So you get inflamed, irritation, and the body arming itself as if it's going to war, but it's not going to war. It's just being poked. It's being stimulated. It's being attacked, but not by an infection, and doesn't need to hide its iron. So we're going to talk about that for a second. Let's look at this. All right, I'm going to share my screen now. Okay, here we go. So here's a good example. If you look up on Google, you'll find iron deficiency, anemia, and inflammation. So inflammation can cause the increase of a chemical called hepcidin, which responds to the infection by removing iron from the circulation. So it's not available to what it thinks are these, quote, invaders, essentially stunting their ability to grow and replace another red blood cell. So that's how inflammation can affect your, not just your iron levels, but your red blood cell levels. And then you can feel sick and tired and weak. And all of this then comes from this stimulation to inflammation. Well, why are you getting inflamed? Okay, let's explain that. Okay, let's share the next screen. The reason you're getting inflamed may be because of your diet. Okay, in other words, what we found is if you eat certain kinds of foods, they cause you to respond by the body believing it's being infected, it's being attacked, it's being sick. And so there are a variety of studies, and we'll look at a couple here. So this is an example from a Harvard Health letter talking about foods that cause inflammation. Number one is refined carbohydrates. So that's like white bread, sugar, sweets, junk food, things like that. And then French fries and other fried foods. So that's hot oil at high temperature includes in the body then a variety of damaging chemicals that the body then finds is a damaging event. And so it responds by trying to protect itself, by turning on the army to defend itself, basically. And a red meat, burgers, steaks, processed meats, hot dogs, sausages, deli meats, things like that. And then, of course, all kinds of what's called saturated fats, but just you can think of margarine, butter, oils, things like that. So when you eat these kinds of foods and you eat them irregularly, when you lose sleep, and we add to that by being immobile and sitting watching TV, all of these things are bad for your health. And in this case, what it means by bad for your health is means you get sick. And in that case, the body responds by turning out the National Guard. It's trying to protect itself. You have damaged the miraculous system by which we all live, and the body is frightened. It doesn't know what to do, so it turns on inflammation. That inflammation then secondarily lowers your iron, because that's part of its alerting the ICBM missiles for attack. Incoming, we've got a battle here. So when this happens, it lowers the iron. No matter how much you take, you're going to have low iron because your body thinks it's sick, it's being invaded, it has to attack back. Now, that's terrible, but on the other hand, it's good because it's easy to fix. Eat healthy, get sleep, and exercise. Get up off the couch, turn off the TV. So let's go on to what are the food things you can do. So here are the worst things. Again, just these are the things to get rid of. Stop eating processed meats. Stop eating refined sugar. Stop eating saturated fats. Stop eating those things that have artificial sweeteners, artificial preservatives, solvents, and things like that. Stop eating artificial or trans fats, vegetable oils, and alcohol, because all these things cause damage, especially if you take them more than small amounts. Here's another comment, and this one's 12 ways to reduce inflammation just overnight. Eat a salad every day with green vegetables, but beware of salad dressing. The oil in salad dressing, unless it's an extra virgin olive oil, can be as damaging as anything else. Go to bed. Spices are good. Lose the alcohol. Instead of coffee, how about green tea? And be careful to see what you are eating at the time. There are a lot of foods that you can eat that are non-inflammatory. That is, they calm the attack signal down. And in addition, have high iron. Okay, including things you might not think about like fruits. So apples, bananas, pomegranates, all those things are good. And in addition, many other fruits like oranges and other citrus are high in vitamin C, which improves the absorption of iron. So that's a really good choice. Here's another commentary which says, eat a wide variety of healthy foods, especially fruits and vegetables, and you'll get all the components that have an anti-inflammatory properties. We know when you have high levels of these anti-inflammatory foods in your diet, you can significantly reduce the levels of inflammation in the blood and tissues throughout the body. These breakfast, lunch, and dinner recipes give you a few ideas here. And then, of course, it says just below that, cut back on pro-inflammatory foods. And they give a link here. We'll go take a look. Cut back. This is from Consumer Reports. And they point out a new study shows eating to fight inflammation may lower heart disease and stroke. So not only is it iron a problem, but also death from heart attack or stroke. And so it talks about inflammation, and then they talk about cabbage, kale, orange and yellow stuffed peppers, sweet potatoes, carrots, corn tortillas, whole grain, please, butternut squash, whole grain, buckwheat, soba noodles, walnuts, a lot of new research. So eating healthy then can raise your iron, and you don't have to eat beef and these other foods because sometimes they are counterproductive. In trying to eat a high iron diet, where a lot of doctors will recommend beef, red meat, liver, things like that, that's also inflammatory. So you may be harming the ability of the body to release that iron and create red blood cells. So then you end up back in the ER with iron infusions or blood transfusions in some cases. So again, it can be kind of complicated. Let me close this one off too. but I'll go over it again. So this is the story which gets confused by doctors, surgeons, and patients. So let me summarize it. If you have low iron after MGB, number one, it's complicated, call me. If you don't want to, and you want a summary of what we're doing, and what should be done, what our advice is, it's really simple. Number one, the majority of iron deficiency occurs in women who are having a menstrual cycle. They lose the iron in their bloodstream from their menstrual cycle. And the simple solution to that is to use one of the treatments that are very simple and very successful, and that is to decrease the menstrual blood flow. If you want to have pregnancy, then you can take away one of the drugs, go ahead and proceed with pregnancy. And oftentimes it will be better because you've had a good iron and been healthy up to the time of pregnancy. So all that can be managed easily. And oftentimes you, your friends, your doctors, even your bariatric surgeon can be confused about this. It's a trivial problem, easy to manage if you know what you're doing. If it's confusing or if your doctor's unsure, call me anytime. I'm happy to talk with you or your doctor. Number two, there are a small percentage of people out of all the people who get iron deficiency, which is about 10 to 20% of our women, sooner or later will see low iron. But of those people who do get a low iron, the vast majority are taken care of by cutting down the blood loss from their menstrual cycle. The other group often are eating a bad diet. They're also not sleeping well. They're not paying attention to that. They might be eating particularly bad foods, not exercising, watching TV, and then not sleeping well. That combination causes inflammation. Bad food causes inflammation. Meat, dairy, eggs, fatty foods, sugar, junk foods, processed foods, all of these things attack the body. They make you sick, and they can cause a heart attack, stroke, death, and cancer. You don't want those things. And by changing away from those things and eating a normal, healthy diet and living a normal, healthy life, humans were not meant to sit in front of the TV all day. They're not meant to stay up all night. We're meant to sleep. All these things are things I'm happy to help you with, and they can be hard to stop because they are addictive. That is, it's great to watch a wonderful TV show. It's great to stay up late. It's great to have an alcoholic drink, and it's great to eat junky foods. They taste good. But heroin, nicotine, cocaine, all of those things also give you short-term positive feelings, but over time are damaging and deadly. In the same way, live a healthier life. If you'd like specific advice and examples to go through exactly how you're living, exactly the things that you're doing, and see how we can help, please call anytime. I'm happy to help. I will brag on one of my most difficult patients is a gentleman not far from me who has been fighting for a long time to get out of a combination of troubles that I just mentioned. And he has finally done that. We're not out of the woods yet, and I don't have permission to share his name, but let me honor him in this presentation. He has had quite a battle with many of those problems I just described, and he seems to be coming through. So it's possible to get better from all these things. It's possible to get healthier. It's possible, for example, to get your liver function test back and normal, all by doing things that are just common sense. If your mama was talking to you, she would give you maybe a slap upside the head and say, go to bed, turn off the TV, get up off the couch and eat healthy. Stop eating that junk food. So this is Dr. Rutledge, yo mama. No, sorry, that sounds foolish. Saying goodbye, and call me if I can be of any help. Thank you and goodbye.